I was told by a dentist that I was needing to have my teeth removed because, unbeknownst to me, I had some decay going on underneath my existing crowns. So they recommended that I see a specialist. Well, I immediately thought of Dr. Clark because I've known him my whole life, knew he was an oral surgeon. Fortunately, I hadn't needed his services before then, but I went to see him, and then I learned that Dr. Ash could do the implant part and Dr. Clark could do the extraction part.
Karen came to us initially because she felt when she was chewing food, her upper teeth were loose, and she was worried that there was something wrong. After a consultation with Dr. Clark and advanced 3D imaging, we determined that by extracting those teeth and placing implants, we can give her function back. Since her procedure, she has expressed to us that she's now enjoying eating and the quality of her life has improved dramatically, and she has the ability to chew whatever she likes.
I was very impressed with the fact that they were a team, that one knew what the other one was doing. They consult with each other. It wasn't a separation of services. I felt like it was one unique coverage of service. In my classroom, I have a statement with Maya Angelou that says, it's not what someone says or what they do, it's how they make you feel. And I honestly can say when I'm in either of the two doctors' offices, I feel very secure, I feel unafraid, I feel like I understand what they're doing. I feel confident that the outcome will be good, and I definitely would recommend my family, my friends, anyone that may need their services.